Multiple sclerosis, MS, is a chronic autoimmune disease of the central nervous system, CNS, which includes the brain and spinal cord. In MS, the immune system mistakenly attacks the protective sheath, myelin, that covers nerve fibers, leading to communication problems between the brain and the rest of the body. Over time, this can cause permanent damage or deterioration of the nerves themselves. Demyelination. MS is characterized by focal areas of inflammation, leading to the destruction of myelin in the CNS. This myelin loss impairs the ability of nerves to conduct electrical impulses. Axonal damage. In addition to demyelination, Mississippi also involves axonal damage, which can lead to irreversible neuronal injury and is responsible for the permanent disability seen in the disease. Plaque formation. Lesions or plaques are formed where myelin has been destroyed, which can be detected through MRI scans. These plaques disrupt nerve transmission, leading to the symptoms of MS. Etiology. The exact cause of MS remains unknown, but it is believed to result from a combination of genetic and environmental factors. Genetic predisposition. Certain genes may increase susceptibility to MS. Having a family history of the disease can slightly increase the risk. Environmental triggers. Potential environmental factors include viral infections, for example, Epstein-Barr virus, low vitamin D levels, smoking, and geographic location, with a higher prevalence in areas farther from the equator. Autoimmune reaction. The disease process begins with an abnormal immune response, where immune cells attack the CNS, targeting myelin and neurons. MS symptoms vary widely depending on the location of the affected nerves, and can range from mild to severe. Common symptoms include physical symptoms, muscle weakness and spasticity, numbness or tingling, usually in the limbs, problems with coordination and balance, blurred or double vision tremors, fatigue, bladder and bowel dysfunction. Cognitive symptoms, memory issues, difficulty concentrating, problems with planning and decision-making. Emotional symptoms, depression, mood swings, anxiety. Diagnosing. MS can be challenging due to the variety of symptoms and their intermittent nature. The diagnosis is typically based on clinical evaluation, neurological examination and medical history, MRI, magnetic resonance imaging. The primary imaging tool used to detect CNS lesions, lumbar puncture, spinal tap. Analysis of cerebrospinal fluid, CSF, can reveal abnormal levels of certain proteins and the presence of oligoclonal bands, indicative of an immune response within the CNS. Evoked potentials. These tests measure the electrical activity in the brain in response to stimuli, helping to detect any slowing in nerve conduction. While there is no cure for MS, several treatment options are available to manage symptoms, reduce the frequency of relapses, and slow disease progression. Disease-modifying therapies, DMTs. These drugs help to reduce the frequency and severity of relapses and slow the progression of MS. Examples include injectable medications, interferons, for example, interferon beta-1a, and glatiramer acetate, oral medications, fingolimod, teriflunomide, dimethyl fumarate, infusions, natalizumab, ocrelizumab, alemtuzumab. Symptomatic treatment, muscle relaxants, baclofen or tizendine for spasticity. Physical therapy helps to maintain mobility and manage muscle stiffness. Medications for fatigue, amantadine or modafinil, pain management, gabapentin or pregabalin for neuropathic pain. Lifestyle modifications. A healthy diet, regular exercise, and smoking cessation are recommended to improve overall health and potentially reduce disease activity. Supportive therapies, cognitive rehabilitation, counseling, and support groups to help cope with the emotional and psychological impact of the disease. The course of MS varies widely among individuals. Some may experience long periods of remission with minimal disability, while others may progress more rapidly to severe disability. Early diagnosis and treatment have improved the outlook for many people with MS, helping to manage symptoms and maintain a good quality of life.